Good afternoon to everyone, dear friends and colleagues, honored chairs. Thank you very much for your introduction, and congratulations to the BANTAO committee for organizing the Congress, and thank you very much for having our abstract and presentation in your Congress. I will present the GFR slope as a predictor of kidney function related to anthropometric parameters. Assessing eGFR is being able through different and difficult formulas, mathematical formulas invented from scientists and clinicists. And until the new methods arrived, it was not easy to assess the GFR through these formulas. I recall it. Okay, is it now? I recall during my residency in nephrology, our assistant professor taught us how to grade the CKD through creatinine levels, not the eGFR. And if the creatinine is 100, you have stage 1. If the creatinine is 200, you have stage 2, and so on. And if the creatinine is above 500, then you have stage 4. Nowadays, this has changed a lot. We can assess kidney function through eGFR, through different formulas, CKD, EPI, MDRD, Salazar, Krotkov-Gault, and we can assess it on any equipment or smart device. This is a screenshot from the telephone that you can input like 6 parameters, and you can have the eGFR of the patient. Knowing these formulas and using this equipment, then you can certify the GFR, the CKD, and also if you put the albuminuria, then the guidelines were produced, the guidelines that teach us how to stratify the CKD and how to follow up our patients. Also, they show the progression of the kidney disease. We conducted a study in 450 patients with CKD, and we tried the aim of the study was to have the formulas on the CKD EPI and eGFR MDRD, and to show if they have any differences and how do they affect in the body surface area if we input the parameter of body surface area, and how do they affect in how can we assess the attenuating of CKD progression. Our patients these are the demographics of our patients and the ages of their. This is the first eGFR assessment and to our population. This is the first and last eGFR. We followed them for 36 months, the first and last eGFR. The last eGFR assessment. Now, here we have some of late breaks. So according to parameters, to anthropometric parameters, body mass index and body surface area, we have seen that only 1% of our population were in the body surface area 1.73 meters squares, and the big population, 82%, were above this constant that it's put on the formulas, and 70% were under the BSA on the formula. So putting and personalizing the BSA put the more accurate, you have the more accurate eGFR. Measured GFR still is the gold standard and the best way to assess kidney function in the guidelines, but it remains cumbersome. eGFR with standardized BSA, then you have, this is good for laboratory medicine. BSA is an important parameter in CKD, EPI, and MDRD formula. To summarize, we had on our population, we had minus, at the end of the study, we have minus 510 milliliters. 20 of our patients went to dialysis, and 3 of them on the kidney transplant. So these are the conclusions again. thank you very much for your attention. And this, we have the great expectation for ERA Stockholm Congress. And I would like to invite you all in our annual Congress in Pristina next month, in 17th to 19th November, where we have this international Congress with hands-on course on interventional nephrology. Thank you very much.